The next speaker is Pierpaolo Dal Monte. Pierpaolo Dal Monte is a surgeon. He belonged to the movement for happy degrowth and is working with us in this project about health and degrowth.
Thank you, Jean. Hi, everybody. I'm talking about sustainable healthcare, and I call the modern medicine paradigm the Promethean paradigm because the modern medicine paradigm tried to achieve the domination of the illness while it's something that is not possible. I always start my presentation with a quotation. This is Jacques Ellul. It was a great scholar in the theorization of the superpower of the technological universe, and technology has arrived at such point in its evolution that it's being transformed and it's progressing almost without the decisive intervention by man. That's what is happening in our modern world. And if we start to think to the anatomy of a century, last century, you know the line of the life expectancy in the developed countries increase quite proportionally to the increase of the real GDP. But if we analyze the death cause in developing and developed regions, we can discover that in developing regions the biggest causes of death are acute disease and especially infectious disease, while in developed countries they are chronic disease, especially cancer and cardiovascular illness. And the life expectancy in the 20th century was especially due to the life condition, higher hygiene and better nutrition, and in a little part due by medical technology, especially with the introduction of antibiotics, the aseptic surgery, and the modern intensive care. So, the modern vision of the medicine, what I call the Promethean model, is the infinite progress from the hell to the paradise. That's the picture of the paradise as it was conceived in the Middle Age. But, you know, the increase of technology means an increase of expenses and the decrease of marginal return. The decrease of marginal return was theorized by the economist David Ricardo, and to put it simple, we can say with 20% of investment, one can obtain 80% of success. But we need 80% of investment to obtain the remaining 20% of success. And it's clearly evident that in the cost versus benefits in the US healthcare system. As you know, as you can see, it's a dramatically decreasing curve. Because the productivity index, I don't like to speak about productivity when I speak about health, but you know, the parameters, the official parameters are those. So the productivity in all the Western world is decreasing dramatically. Oh, sorry. So if we can see that productivity, as we called in the former slide, and we analyze the health expenditure versus life expectancy, we can see that the US has the biggest, the highest health expenditure, while the productivity is very low, as you can see in the graphic on the left. Cuba has the best one, but you know, in Cuba, people forget to say that a chief of department earn about $25 per month, so it's a little bit biased, that of Cuba. But if you can see, the United States are at the 38th place for life expectancy and at the 33rd place for infant mortality. So the US performance is not very bright in spite of the highest expenditure. So, the modern vision is the infinite progress, but we cannot sustain it. So what's the future in the vision of the scientists and the doctor? The future is like robotic microtechnologies or nanotechnologies or gene therapy, but I don't think it's sustainable because in the future we have to deal with with all of these small problems like economic crisis, scarcity of resources, climate change, overpopulation, unemployment, and they're infinite to list. And I just reported the case of Russia. Russia is a typical case of a collapse of a modern society. In just 2 years, between 1999 and 92, the life expectancies for male decreased of 7 years. So if our global system collapses, we cannot afford anymore our kind of healthcare. So all of this is fantastic, but what can happen if we could not afford it anymore? So which is the contemporary model of scientific medicine? The goals are unlimited scientific progress and technological innovation regardless their long-term cost. Medical progress and technological innovation are allowed to set medical goals. So we don't, as doctors or as patients, we don't set any medical goal, but it's the technological innovation that means the industry, basically. I'm a surgeon, so I know very well that most of technological innovation are, to speak French, bullshit, basically. So there's nothing evident. And the outcomes, the considerable medical progress and creation of a massive medical industrial complex and powerful bias towards cure rather than care and technological intervention rather than health promotion, disease prevention. What's the result? An unsustainable socioeconomic pressure on all the healthcare system. We can see very well in Europe, there are people from Greece, there are people from Spain, we are from Italy, so we know very well what's happening now because of the financial crisis. And in the United States, it's estimated from 40 to 50% of cost increases due to the technological factor. And due to the technological factor, the increase of the expenditure is about 10 to 50% per year. So the technological factor has a great impact in increasing the health expenditure and the insustainability of the system. That's the classical definition of sustainability from the Degrowth Commission, and it's quite superficial, but it's not so bad. Sustainability means that the system should meet the needs of the present without compromising the ability of future generations to meet their own needs. It's not happening. So what's sustainability? This is a graphic just to show. And another definition of health that depends on the ability, that's health considered by the sustainability aspect, depends on the ability to manage successfully the interaction between the physical, spiritual, biological, and economic social environment. That's not happening at all. So what's sustainable medicine? Equitable and accessible to all, affordable to national healthcare system, but moreover, equitable and affordable in the long run, not simply for a few years. So, are we living in a sustainable system? The quiet conscience is an invention of the devil. What about the rest of the world? As Dr. Gardini showed, this is the dramatic difference in life expectancies between developed and developing countries. And the causes of death. As you can see, in developing countries, the causes of death are highly related to acute and infectious disease, while in developed countries, the causes of death are much more related to chronic and heart or neoplastic disease. So we can see that our technological medicine has a great success in cure acute disease, but it's a complete failure in cure chronic disease. I always joke with my friend dermatologist. I said if they didn't invent cortisone, you wouldn't exist, basically. And this is I'm almost finished. This is the distribution of the doctors for inhabitants. As you can see in Tanzania and Zimbabwe, there is one doctor every 50,000 people, while in Italy, one doctor every 230 people, in Cuba even more. So, oh, sorry, I'm going back. So, the modern technological healthcare is a reality only for a third of the world population. Malnutrition affects 3 billion people. Undernutrition, 1 billion people. 2 billion people don't have access to safe water, and 2.6 billion people don't have access to basic healthcare. So, can we call, oh, my finger is not so. Can we call sustainable a situation where a small part of the world is like this, while a greater part is like this? That's my conclusion, basically. Thank you for your attention.